This is a multidisciplinary approach to patient care. I'm Kelly Bowers. I'm a second-year nutrition student at UNE.
My name is Zach Charon, and I'm a second-year medical student at Rosalind.
I'm Josh Hall. I'm a second-year dental student at UNE. So a quick introduction to the case is the patient is a 6-year-old female that is presenting with chronic asthmatic episodes. The patient and her family has recently moved to a new home in a rural area. The patient has the familial considerations listed. The school has shown concern on her recent status, and she is currently on a new regimen of medication.
We are Team 3, also known as the Meerkat Mob, and our care team consisted of the members listed here.
So considering the osteopathic, allopathic, and physician assistant perspective on the case, some of the biggest concerns were establishing and confirming the patient's diagnosis of asthma and curating an ideal medication regimen to improve symptoms and quality of life. The following pharmacological interventions were utilized. Some additional concerns included the fact that the patient was clearly lacking continuity of care as a result of the family's move, frequent urgent care visits that were rushed and not comprehensive, a large medication regimen that was not instructed on how to be used appropriately and adequately. And so inquiring about the current plan and additional substances and supplements were a huge step in the right direction, as well as understanding compliance barriers.
So for the dental hygiene and dental medicine approach, we were aware that the primary concerns of the patient are not regarding the patient's oral hygiene. Therefore, we attempted to take a holistic approach to the case, looking at the patient's overall health. In addition to this, we are aware that improving the patient's symptoms in the oral cavity will greatly improve her quality of life. Some of the concerns that needed to be addressed was the family's access to fluoridated water, possible dry mouth caused by medications, and possible carious lesions that are already present. Some possible clinical interventions would be fluoride supplements and suggested visits to dental clinics.
Occupational therapy, social work, and nutrition had some overlap in our interest in possible interventions. Our primary concerns were with how Charlotte's illness, the family's recent move, and a new baby on the way were disrupting the family's usual roles, routines, and habits, and we wanted to leverage existing community supports to mitigate further disruption. We're also concerned with how her illness was impacting her personally with like her school and social interactions, her mental health, nutrition, sleep, and what realistic changes could we make to improve these. Ultimately, our goal was to find out how we could address these concerns and best support Charlotte and her family.
Considering some of the lessons learned from this case and from the team, we learned that multidisciplinary teams improve the quality of care for patients far beyond any sort of individual or separate care that we can provide. Integrating care secures full and continuous support for the patient throughout all stages and enhances the patient experiences. Healthcare providers can develop critical and long-lasting relationships amongst one another while bolstering quality improvement and continuing education. And ultimately, this improves the quality of life for the provider and patient alike.
That concludes our presentation.
Thank you, Meerkat Mob. I'm Sarah Garber, and I'm facilitating this session. I'm from Rosalind, Franklin. I think we have members of the team here. Are there any questions for the team? If not, I will put one out there. For the team members, how did you determine which roles and responsibilities in your team project and how you interacted with the patient?
I can take that. My name is Erin. I'm a DO student at UNE, and we met beforehand before each of these telehealth visits, and we planned on certain objectives that we wanted to address with the patient's mother and father. And me and the other MD student and PA student took a look at medications, and then we had a dental student and a dental hygienist student that looked at oral health considerations. And a big part of this case was also utilizing social work to leverage access. They were, I think, 2 hours away from the nearest doctor. They had moved into a home and there was risk of mold exposure. So just having us all kind of use our strengths to address all parts of this really complex case that was not black and white was really important.
Thank you for that. If anybody would like to ask a question and put it in the chat, please do so. It can be hard for me to identify hands raised. One question from the chat was, were there any tensions with the overlap between roles or opportunities discovered with those overlaps?
I can take that one. We kind of, in our team, I think we all just meshed really well, and the communication was the biggest part in like introducing the roles and how we went between the roles. We based on our objectives, like Erin said, we decided who we wanted to go in to the interview and ask the questions. Overall, I think we just worked really well as a group. and there wasn't that much tension between any of us.
Thank you so much. Another question from the chat is, how has this experience altered your career path or influenced your career path?
I think for that question, I've been thinking about this a lot since this experience, and it has really opened my eyes to how complex patient cases are, and they're not, a disease card. There's, family considerations, environmental, and so to take on these really complex cases, you need to utilize your resources. So moving forward, I'm definitely going to use my allies in healthcare, whether that be pharmacy students or social workers are really important in helping your patient live a full and happy life.
Thank you. Also from the chat, did a leader emerge, a specific leader, or was it more of a fluid leadership type of situation within the team?
I can take that. I think we did really well about just kind of trading off and sort of, somebody would sort of take the lead for the first interview and then we would kind of move on from there depending upon what we learned. But I think we did a really good job of just allowing that to be fluid and figuring out who would be best to take on that role to best serve the patient.
Excellent. That sounds like real cooperation and a lot of communication. And with that, what was the biggest take-home message that you found with this experience?
I think just how important it is to find sort of those allies in healthcare, like Erin said before, and just really utilizing the whole team and understanding that everyone has something to contribute.
Excellent. Any last thoughts or comments? Okay. Well, thank you very much, Team Meerkat Mom. Excellent presentation, and we look forward to seeing you in practice.
Welcome. We are Team Coyote. Thanks for joining us today. We are going to present to you the importance of patient education. The team today this is the team that helped us put our case together. And the team that will be presenting to you today is Mahal Averas Bacchus, Regina Wu, myself, Jessica Cilio, and Sarah McAndrews. And with that, I'm going to hand it over to Sarah to run through the case with you.
The case that we worked on was about Charlotte, who is a 6-year-old girl who has been diagnosed with allergen-induced asthma. Recently, her family moved to the suburbs away from the city, and Mr. and Mrs. Soto have been worried about their daughter due to her lack of energy, frequent urgent care visits, and the many medications she has been given and is currently taking without much background information. Since they moved, they're a 30-minute drive to the closest urgent care, and they're experiencing financial constraints and are dependent on Mr. Soto's VA disability as Mrs. Soto is not working. They have no extended family support and have not established a new healthcare team yet. And now I'll pass it to Regina for the case process.
During the care process, we focus on educating the parents about Charlotte's medications, such as when to take them, how often, and performing oral care after use. We suggested formulating an asthma action plan and obtaining a nebulizer for easier inhaler use. Advice on discontinuation of Montelukast and avoiding use of natural supplements. Lastly, we recommended a consult with social services to provide care and community resources in their new place of living. Now I'll pass it on to Mahal.
We had a couple of key takeaways. Some of them included making sure that patients were on the care team as members who deserve complete information about medications in order to make informed decisions about what they wanted to include on their medication panel and what they didn't want to include based off of side effects. We also learned a lot about how social determinants of health and access to healthcare really act as barriers to wellness and health outcomes. And finally, we thought a lot about the importance of community and resources and access to resources and how to connect our patients to those resources.
With that, we would like to give a special thank you to our facilitators of this case study who helped us. And we look forward to answering any questions you may have. Thank you.
Thank you, Team Coyotes. Please feel free to put questions in the chat. If you raise your hand, hopefully we'll see you, but if you're raising your hand and just want to unmute and shout out, that's also fine too. And we are open for questions for this team. I can start off with the team. It was a pleasure working with you. I was the facilitator for this team. But what was the takeaways that you learned from each other? What do you think you will take on in your professional life as a lesson?
I can jump in. There was a lot actually to that list. It was a great experience. I think I think it's one I had no idea. You kind of come in for one reason and take away so much more on the end. But one of the biggest takeaways, I think, for me is just the realization of what the other positions in this group, how important they really were, and maybe the different aspects that they could bring to the table that I wasn't even aware of. I think the social worker was the biggest takeaway for me, or aha moment, where it was like, oh my gosh, this person is so valuable to the team and what they can bring. And I mean, I always knew they were a valuable person, but there was just so much more that they were able to bring to the table that I just didn't fully appreciate before this experience.
Yeah, I agree with Jessica. Like also when I was coming in, obviously I knew about all of these healthcare roles, but I didn't know what exactly, like all the specifics that they're about. I feel like as a nurse, we learn a lot about every field, but we don't go in depth into every role, if that makes any sense. But yeah, so I feel like I learned a lot about everybody and what they do, and it was actually really fun and really nice chatting with everyone just to get different perspectives on what to do with the case. So.
It's often different learning about things versus doing those things and getting the takeaway there. There's a question in the chat about the team spent a lot of time on patient education and finding resources. Were there any resources that you found that surprised you or you didn't know about beforehand?
I would jump back to the social worker, and probably I think she was a much bigger part in our case study that we focused on. We did focus on a lot of the medication side of it because we felt there was a lot, and it sounded like the parents really they were uncertain of all the side effects, I believe. And so really providing that education felt very important in this situation. And it was really cool as a team, us coming together to really figure that out. And then who was the best person to provide that education? Because there's several different areas, from the social worker to the nurses, doctors. Yeah, I think the social worker probably was the biggest takeaway for me, because she could have offered so much as far as just family support and local support there. And so, yeah, that was probably my biggest takeaway.
Interesting. We learn so much when we participate, don't we? Are there any opportunities for the community to support clients that surprised you or that you learned about and didn't know about before?
Let me make sure I understand that question. Opportunities for our community to support those clients. So different services, is that what that question is asking?
Community resources, I think.
Yeah, I think there's a ton of resources, more than I think I know me personally even know. Like I think my world just keeps expanding the more I learn and jump into the healthcare profession. But I know even like our homeless shelters, they offer a ton of help, more help than I even realized. And I think there's a lot of opportunities for even healthcare professionals to work with these community services to even expand the opportunities that some of these individuals could have. Did I answer that?
Absolutely. Thank you. And finally, what was the hardest thing about this for you?
I personally didn't really find it that difficult, maybe because we had so many people in our team that were all willing to like speak up and give their opinions and feedback and whatnot. But I think the only challenge we had was during the second meeting when our dental student and our social worker student couldn't make it to the meeting. And it was tough because the dental student was the healthcare professional that we had placed as the familiar face with the patient from the very beginning. So we kind of lost that. And then so we had to introduce new healthcare workers to the patient. And then again, like Jessica said, the social worker, if she was there at our second meeting, she could have been able to provide so much more information to the patient than we could. Like we could only come up with so much, and I'm sure for social workers, they have a special way of delivering information to the patient that we probably could have done better with, but that was the only challenge I found.
I absolutely agree with that, Regina. And the only thing I would tag on to the end is I was looking for like this solid answer, like here is the fix to your problem. And in these situations, in case there's just not one fix. It was really like it's a continuous thing. So at the end of it, I wanted to see how, Mrs. Soto was doing and how her baby was and like the follow-up, and it almost became real, which it was kind of fun. But so it wasn't really a problem, but just kind of a fun thing on the end. It was like, I wish there would have been like, oh, how are they doing in that follow-up?
I can provide that follow-up. We do have another case with Mrs. Soto, and she does deliver, and everybody's fine. It was a little dicey there, but everybody's okay. So thank you so much for that. I think we're ready to, thank you so much for your presentation and great job. And we will move to the next presentation. Okay, we are going to start our next presentation from the Life Saving Lobsters Team 4, the Interprofessional Team Immersion, or IFTE.
A student dentist, pharmacist, nutritionist, doctor, occupational therapist, and social worker walk into a Zoom meeting for the first time. They're told to work together as an interprofessional team. What could go wrong? Our group analyzed the interprofessional healthcare delivery over telehealth pros and cons. Our group consisted of Lauren Elblatt from dental medicine, Ethan Gagnon from pharmacy, Luciana Gizzo from osteopathic medicine, Anna Lindenmayer from occupational therapy, Christine Papa from applied nutrition, and Rachel Ryan from social work. We were supervised by Denise Blaze, Patricia Day, and Dr. Kim Lee. Thank you so much for your support. We shared many unknowns with one another about our professions prior to meeting each other. Our biases and gaps in knowledge centered on uncertainty around our scope of practice, philosophy of care, and nature of work. We found it to be an enriching conversation that expanded understandings of each field, and we took this new knowledge into our simulation. As a team, we discussed some of our interprofessional goals at the start of our simulation experience. Some of those were considering the effects of telehealth on patient access to care, as well as the effect of distance on patient treatment adherence and healthcare outcomes, utilizing motivational interviewing to connect with and validate patient experience despite barriers of telehealth, share team biases of health professions, and work towards a greater understanding of one another's field. We outlined many advantages and disadvantages in our poster, but our key takeaway was the importance of streamlined communication. While our diverse team brought a wealth of perspectives, we realized that presenting information to the Sotos in a cohesive and efficient manner proved challenging. In hindsight, we recognized the need for a more structured communication strategy, perhaps assigning a lead spokesperson or utilizing a concise summary document that integrates perspectives from various professions. Furthermore, our experience highlighted the significance of striking the right balance between inclusivity and efficiency. While involving multiple healthcare professions enriched our understanding, it also led to over-analysis and potential delays in delivering recommendations. In future endeavors, we would consider a more targeted selection of professions directly relevant to the case at hand, ensuring a focused and efficient collaboration. This approach would enable us to maintain the benefits of diverse perspectives while mitigating the challenges associated with information overload. Overall, our learnings emphasize the importance of refining our collaborative processes to enhance the impact of interprofessional healthcare teams in delivering optimal patient care. Thank you so much.
Well, thank you, Lobsters. It sounds like a lot can happen when a number of healthcare professionals get into a room and are given a case. So if you have a question, please shout it out or put it in the chat. I can't always see you if you raise your hand, so feel free to do that. And I can get started on this by asking how did the team determine the roles or who should be working with the patient at a particular time? How is that done? Was there a fluid leadership style or a set leader?
I can take this one. I'm the social work student. My name's Rachel. I think that we were approaching it pretty horizontally and collaboratively, and none of us really wanted to step forward initially, which I think, as our presentation showed, was really beneficial in terms of us learning from everyone, like as what we do as professionals and what we can bring to a case. I think that some of the order of approaching our patient sort of was determined by the case itself and what their needs were, how we prioritized them, and that kind of determined who went first, who went second, etc.
Were there any bottom lines that you would say about leadership, or suggestions that you could give to the next group of students, perhaps?
I would say that there are pros and cons to both having an established leader and taking a more fluid approach to it. I think that definitely determining that earlier on as a team would be helpful to like the efficacy of the team itself. And I also think that if there were a determined leader, I think that creating a space where collaboration and sharing opposing opinions was welcomed and encouraged would actually be beneficial.
And just going off of that, I'm Luciana. I'm the comms student who's a part of this project. I think having a streamline leader is kind of like a point of reference for Mrs. Soto would be helpful too. So she has somebody that she knows she can rely on for direct communication. And I think our team did a really good job of directly addressing her in different settings when it was appropriate for each person. But I think having her one person that she could connect with would be really helpful as well.
Thank you for those insights. There's a question in the chat which starts off: sometimes in IPD, an unexpected profession ends up having a larger role in a case due to a client or caregiver rapport. Was that something that the Life-Saving Lobsters experienced?
I feel like pharmacy played a very big role in our group. I think it was very pharmacologically heavy. And I think me as the dental student, I had a bit of a smaller role. So that was interesting for me to take a step back.
Do you feel as though all the members of your team were more or less on an equal footing with the client, or was there one person that was more interactive with the client and actually the parents of the client?
I didn't really notice like a difference in rapport amongst all the professionals. I do think given the nature of the case, as Lauren said, some people interacted more with Mr. and Mrs. Soto, but that was more just determined on their needs rather than how they were getting along or the relationship that was building between them.
I agree with Rachel. I think, and also Rachel did a wonderful job, I think, as the social worker, and I think social work and pharmacy were the two predominant leaders in our case, just based on the needs that Mrs. Soto was communicating. We felt that at the time that was the best way to address all of her concerns, was to have her, Rachel, and Ethan be at the forefront. And I think everybody else that had smaller roles in the case still communicated really professionally with Mrs. Soto as well.
Thank you for that. What was the hardest thing you encountered about teamwork?
I'll speak for myself. I found that timing was always just way too little of it. Especially like I was so interested in learning from everyone. This was my first time interacting with a lot of the different professions, and everyone had so much to like bring to this case in terms of how they conceptualized it. And I feel like we were just coming up with way more ideas than were possible to fit into the short 20-minute interactions we had with the patient. So striking that balance was, I think, something that we struggled with and would be something I would keep in mind in the future.
Are there any takeaways that each of you would bring or continue to carry with you as you become professionals and are out there on your own with the clients?
I think for me, as a future physician, it was a really great opportunity to see exactly what the other professions do. This was my first time interacting with a lot of these professions. So I think it'll really help me with my patient care in the future, because now I have a better understanding of exactly what my colleagues do and how they can be helpful.
Yeah, and I think also I created new friendships with these people. So I will definitely lean on them in the future when I run into problems in dentistry.
And I'm taking away the value of like different perspectives and in approaching a case and like client needs.
Thank you. I think having those phone numbers of your now friends and colleagues is very important going forward. Any words of advice to the next IPD team that's going to come up and deal with the case in the next IPD sessions this spring, I think?
Maybe striking a balance between information gathering and information presentation that is timely and effective.
Going off of that, I think time management in general is a key part of this case. Like we were saying, we came up with so many ideas, but you're limited, especially in the telehealth world in general. And that's a good skill for us to learn of how to really prioritize and address their concerns as best you can in the time that you're given.
Okay, thank you. I think we'll wrap this presentation up. Thank you so much for an excellent presentation. Great job. Our next presentation from the Interprofessional Team Immersion Program is going to be the Squid Squad, Team 6.
Good evening. This is our IPTE Honors Distinction presentation, Bridging the Path Towards Exemplary Care, a Journey Shared Amongst Professionals. Our team consisted of osteopathic medicine, nutrition, social work, dentistry, and physical therapy. Our approach was to first begin by gathering information about living conditions, both previous and current, medications, symptoms, and all of the concerns that the parents and child have. We then began to build bridges, which are collating plans to utilize knowledge from active research to attack previous concerns and current concerns, side effects of medications, and to clear up any discrepancies amongst the parents or child. We then applied that knowledge for them in a way that Mr. and Mrs. Soto could actively implement into their home and provided solutions for different pathways and education for moving forward.
To our revisions from our original plan, we took individual analysis and incorporated both that and the parents' concerns and collaborated in order to find a new plan. We took that new plan and took it into the patient encounter where we were able to further address the parents' concerns. Through an additional debrief, we were able to absorb critical feedback from the parents in order to change our plan further and further address their concerns appropriately.
Okay, so just discussing everything that we've done. By dividing our sessions into two parts, we were able to kind of learn and reflect on all the choices that we've done. Listening to the patients, which is where everything starts off, being able to address needs one by one, finding solutions, then kind of starting the process over when they have new questions and they're coming to the meet. The conclusion allowed us to follow a systemic approach laid out for us and establish positive and healthy communication between members of the multidisciplinary team and the patient as well. And that is all we have today. Thank you all for your time.
Thank you for your presentation, Team Squids. I have one to start with, and that is, you said that you had an original plan and then modified it. How did that work with your team? Was there a leader? What was the discussion like?
I could take that one. So when I say we had a plan, just kind of piggybacking off from the very first session we had for the very first breakout room, we listened to the patient, we kind of gathered all the information, we examined all the medications she had, and everybody kind of went to work in their respective field on how to combat that, if there's any possible side effects and stuff. I was part of the nutrition, and I know she talked about holistic options. So I know on my end, I looked into the supplements that she listed to see if that would have any interactions with her medicine and if there was something that I could advise her on in place of that. I wouldn't say that we had a definite leader. It kind of just went around. We kind of said, hey, I think we should take it from this approach, or someone would be like, hey, I think we should, do more of this or less of that or whatever. It was everyone was really involved and were very strong in their input.
So more of a fluid leadership style. Was there any particular profession or professions that were?
Other member Liz, I think she did osteopathic medicine because we felt like the situation kind of needed more of that. So I know she was a common ground for that, and getting information and knowing about the medications and being able to kind of recommend or prescribe what was needed for her to help out with her with the patient's interactions.
What's the hardest thing about the teamwork, working in a team?
Deciding, I think for me, the hardest part was definitely just trying to decide where the best path were to take, because in that first session that we had, we did a really good job at gaining all the information that we possibly could. But then after that, our heads were almost a little scrambled because we were like, now we have to put all these pieces together. We did such a great job at,
gathering all this information, but now we're like, what is the most important thing to address and what is going to be most helpful to this family to move forward in the best way so that we can then start to address all the problems, but what do we need to attack now?
Sam, do you have anything to add?
I just felt that probably the most challenging was how to balance between all the different health fields. So everyone has enough knowledge and a lot of knowledge in their own field, but then coming together and kind of determining who needs to kind of take a step forward and who needs to take a step back. That balance, that was kind of the biggest challenge, I thought.
Was it hard to sort of trust or lean on each other for that kind of knowledge? If you felt you didn't have the knowledge with your profession, was it hard to sort of trust?
No, I don't think so. I kind of just was able to trust that everyone in their own field had that knowledge. So at least for me, I didn't have any issue with that.
Sounds like your team created a safe space for each other. What would you say is sort of a bottom line if you were advising the next group of students going through an IFTE simulation? What would you want to tell them?
I would say, have fun with it, but make sure that communication is frequent and established sooner. I feel like, my group, everyone is so smart and they know what to do when it comes to working together and putting things together. But I know it took a while for us to get going. We just, we have school and we have rotations going on. I know I have my clinical cell going on. Everybody has their stuff going on. And I know I think we would have felt better if we would have got started on everything a little sooner. So just kind of getting that established would help.
I think another important thing is just being able to be flexible, because we had an original plan, but it was important for us to be able to change the plan quickly in that debrief in order to best address what the parents brought up, because we weren't exactly sure what they wanted to address when we went into the encounter. So it was important for us to be able to be flexible to adjust. And I think keeping one person in all of the encounters was also helpful to build rapport and have a safe base for the parents to look toward, even if they're not speaking. Just having them in the room was helpful for us, because they knew that that person was aware of everything that happened during all the encounters, so they knew what was going on.
So aspects of communication, team management, and some consistency would be important. Does that kind of sum it up?
Definitely.
Okay, well, thank you so much.